Your arms are tingling. You can't breathe. You feel like your heart is about to leap right out of your chest. You have absolutely no idea what is happening to you. You try to relax, but you just can't help it. Ladies and gentlemen, you are experiencing a panic attack. What is a panic attack? How can you treat a panic attack? Are there any treatments? These are all questions you ask yourself unless you have personally experienced a panic attack, which can affect anyone at any time. First, let's start by identifying what a panic attack really is. A panic attack is a sudden urge of overwhelming anxiety and fear. According to Wellcome Trust Center of Neuroimaging at University College London, researchers have identified certain regions of the brain that have become hyperactive when a panic attack occurs. One of the regions is the amygdala. The amygdala is the fear center of the brain. And other regions, like parts of the midbrain that control a range of functions, including our experience of pain. The periaqueductal gray is an area of the midbrain, and it provokes the body to be in shock. When all of these functions fail, that's when a panic attack occurs. When this occurs, you may feel dizzy and sick to your stomach. You may even feel like you're dying, going crazy, or about to have a heart attack. A panic attack may be a single occurrence, but many people experience it multiple times. Many people fear of having a panic attack simply because it can happen anywhere at any given time, and most times even without warning. Panic attacks can occur while being in an elevator, riding a roller coaster, or even while preparing a speech for a class that you're really stressed out about. These attacks are one of the biggest health problems in the United States today. At least 20% of adult Americans, or about 60 million people, will suffer from panic attacks at some point in their lives. About 1.7% of adult Americans, or about 3 million people, will have full-blown panic attack disorder at some point in their lives, twice as often for women than men. Now, for people who have already had panic attacks, for example, while being in an elevator, they start to develop phobias. A phobia is a type of anxiety disorder that is defined as a persistent fear of an object or situation that leads to desire of avoiding it. Meaning, if you had a panic attack in an elevator, you start to develop a phobia towards elevators, and you really don't want to step foot in an elevator again, because who wants to relive that? Now, let's talk about some of the symptoms of a panic attack and how it affects the body. Panic attacks can strike when you least expect it. It can vary up to 10 to 30 minutes. Some of the symptoms you feel within these minutes are chest pain, stomach upsets, nausea, numbness in the arms, and hot flashes. Some mental symptoms are fear, a sense of helplessness, and a feeling of being dispatched from one's own body. After dealing with an attack, your body might feel somewhat weak due to a loss of energy. You might feel confused and exhausted because the mind has gone through a lot of anxious and terrifying thoughts. Luckily, there are available treatments that can help reduce the chances of having a panic attack. Now let's talk about some of the treatments available for panic attacks. This disorder is something that you cannot get rid of, but can be treated. It can be treated with medication or cognitive behavior therapy. Medication used for this disorder is to prevent immediate elevation of the symptoms. If you're in the middle of an attack, taking some anti-anxiety medication such as Xanax is recommended. Cognitive behavioral therapy helps people learn to deal with panic symptoms using techniques like breathing and muscle relaxation. Another thing that is beneficial is weighted blankets, something that I have recently started using and it's been amazing. People also gain trust within themselves that panic will not lead to the tragic events they fear. Now, let's have an overview of what we learned about panic attacks. In conclusion, a panic attack is a sudden urge of overwhelming anxiety and fear. It is a disorder that can never go away but can be treated. Some of the major symptoms are dizziness, cold sweat, racing heartbeat, and numbness of the arms. So if any of these symptoms end up happening to you, make sure you calm yourself and contact a doctor as soon as possible.